So essentially, it affords you a natural protection. It essentially helps your immune system get ready. It familiarizes it with this infection without the added risk of exposing yourself to the actual virus. The difference is a lot of people think that natural immunity is better. Certainly not, because the risk is that you expose yourself to the complications of the virus. This is the best way I've explained it to patients, is you're essentially seeing a wanted poster, and this allows the patient to recognize this as an intruder and mount a response accordingly. The other way is you're actually face to face with the culprit, and now you have to defend yourself accordingly. So that kind of tends to help people gather a good sense of why the vaccine is a little bit different than just getting exposed to the virus itself. And of course, that is much safer. Absolutely, it's safe. In medicine, there's always risk and benefit. It's a balance. So to say, there's anything in medicine that's without risk would be untrue. But the balance of the benefit of getting this vaccination outweighs the risk. Are there adverse effects? Absolutely there are. But the risk of getting the actual illness itself and what that exposes you as far as complications, both in the short term and the long term, are far outweighed by the benefits of receiving this vaccination and protecting yourself. It will help you, like I said. It primes your immune system to wage a much more robust response to the virus if you are exposed. If it doesn't prevent you from getting the virus, it will certainly help essentially dampen the effect of the full-blown illness. And again, that of course is something that you would want, because the full effects of the illness they vary, and they can be from very mild symptoms to full-blown pulmonary and multi-organ failure. So absolutely, it will protect you, and I encourage you to get the vaccination. So when you ask the question if the vaccine will make you sick, if you're asking if will you get COVID-19 from the vaccination, you will not. You are not getting any form of the virus. In a sense, it's not live, nor is it a dead virus. What you're getting is an mRNA. Again, these are instructions for your body to produce the picture. You're getting the file, the instructions on how to make that picture and how to recognize it, but you are not in any which way exposed to any component of the virus itself. As far as getting sick, can you have some symptoms at the injection site, meaning some muscle soreness, just myalgias, arthralgias in general, muscle aches, joint pain, some fever? This varies from person to person. That's there. You can get headaches, some nausea, some vomiting, and some people will just have general soreness at the injection site, and that's it. These again will usually resolve within the next 24 to 48 hours after receiving the vaccination. So again, a very small price to pay for the protection that it affords you from the actual illness itself. So again, because this virus is absolutely, it's a novel virus. We were not sure on the long-term effects it has, and so the same way we're not sure about if your natural immunity, the longevity of it. So if you're given the chance of getting vaccinated, absolutely, even if you've been exposed, even if you've been positive in the past, it's still recommended that you receive the vaccination, because it's no guarantee that you're going to be afforded a lifelong protection just because you were naturally exposed to the virus. It will certainly help in, slowing down the spread, but it's not the one and all solution. This is going to require a concerted effort, and back to the basics, just like anything else. So mask up, keep your distance, wash your hands. Proper hygiene is critical, regardless of what aspect you're dealing with, but certainly the vaccination will help strengthen and further bolster those efforts to help minimize the numbers and finally help us get back to what we recognized as our norm before this. So the US government is in the process of obtaining vaccinations from multiple sources. It's not just one source that's being given the whole burden of producing enough, but it will take time. That's why they've done it in tiers, to ensure that your frontline healthcare workers, people who are exposed at a much higher frequency and therefore their risk of getting the illness is much higher, are prioritized. But that certainly does not mean that the general public is not qualified or eligible for the vaccination. It will take time, and that's why, to bring you back on the point of eradicating this pandemic with the vaccination, it's one part. But while you wait to get the vaccination, you can't help the effort by making sure, again, sticking to the basics: wear your mask, wash your hands, keep your distance. Everybody can play a part in this. You are important. What you do is important. Do not be careless with this, because it could mean the life of somebody you love, be it a neighbor, a family member, a friend, or even a stranger on the street. It's time we all started thinking about the we and left the me out of the equation. So essentially, again, it's about prioritizing people whose exposure is much more frequent, and therefore their chances of getting the virus are much higher, which is going to mean frontline workers, from healthcare workers, people in long-term nursing care facilities, both the residents and the employees of those facilities. And then it'll slowly start going into the high-risk population, patients with comorbid conditions, and then of course, the general public. But again, like I said, it's not an issue of just because you don't have the vaccine, it doesn't matter. In the interim, just like we've all been doing, continue following the distancing measures, the masking up, that all of that together is going to help. So that's a great question. The main source that essentially, the whole country kind of is looking to is the CDC. They are essentially utilizing resources from across the nation, different centers, doing research, all being put together in one concerted source for patients and people to reach out and inform themselves, and I encourage them to do that. Don't let your decisions be guided out of misinformation or fear. Educate yourself, strengthen your information as far as what the pandemic is, what the virus is, why you should or shouldn't do something, essentially, including getting the vaccination. But as far as the general public is concerned, I encourage you to get the vaccination. Do not hesitate out of fear and lack of information.